I'm Nikki Collis, I'm the Future Hospital Programme Manager, and I'm here to talk about our progress so far and our plans for the next 12 months. In 2019, the government launched the Health Infrastructure Plan for investment into hospital estate, and this enabled us to consolidate two existing schemes around transforming urgent and emergency care and increasing our theatre capacity into one much bigger build at the front of the Derriford site. The urgent and emergency care facility building will be around 15,000 square metres in size and is really the first phase of a programme of wider redevelopment across the Derriford Hospital site and to transform our service delivery in our out-of-hospital care provision.
Hello, I'm Stuart Windsor. I'm the Future Hospitals Director for University Hospitals Plymouth NHS Trust. So the first phase of our development is really important because it allows us to really transform the front door of the hospital. And that will make such a huge difference for the patients that experience our emergency care, but it will also make a huge difference to staff who work in our emergency department and some of our specialist theatres. The new facility will provide about twice the amount of floor space that we currently have in a modern, bright building. And in terms of patient experience, there'll be a lot more space to care within the building, and that will make such a huge difference. If you think about our current emergency department, it was built many years ago when the level of demand was significantly less than we experience today. So at the moment we have an emergency department that is overcrowded at times, and this will allow us to actually address that fundamental challenge. So as part of the build, we're also putting in place additional theatres, both conventional theatres for day case and inpatient surgery, but also interventional theatres that will support our role as a major trauma centre across the South West, and also some of our specialist services such as stroke pathways. Those will make a huge difference and again be configured so that we make the best use of actually the space that we have available. So one of the big changes that we're making in terms of the configuration of our emergency department is a real focus on same-day emergency care. At the moment, our same-day emergency care pathways are fragmented, and therefore we don't make the best in terms of having all of the right facilities in the right place to actually treat patients the moment they come through the door. If we can turn patients around before they need to come into the hospital, it improves the outcomes and it reduces obviously the crowding within the rest of the hospital. That will give us the capacity to focus on more planned care activities. So same-day emergency care at the front door with imaging in place and all the specialisms that we need to actually turn people around and obviously escalate care if we need to.
Over the last 2 years, our focus has largely been around the development of the business case to justify the investment, working with the clinical teams and doing clinical modelling work to ensure the new building will meet their requirements, and working on the design development of the actual building. Over the next 12 months, we plan to complete our package of enabling works, which will include the demolition of the Plymouth Theatres building, the rerouting of some of our utility services, and the build of a new electricity substation on the site. Please keep an eye on the UHP website for opportunities to get involved. But if you have any questions in the meantime, you can email us at plh-tr.futurehospitalprogram@nhs.net.